Assalamu alaikum. In this video, we are going to discuss disaccharidases deficiency diseases, taking the example of lactose intolerance.
Disaccharidases deficiency can be congenital and can be acquired during lifetime. Congenital disaccharide deficiency is due to some chromosomal defect, whereas acquired disaccharide deficiency is due to some intestinal disease, due to some drug. Now the question here is how intestinal diseases or some drugs cause disaccharide deficiency. Actually, intestinal diseases or drugs affect, we can say injure intestinal mucosa. And as the brush water enzymes are present on mucosal cell membrane of intestine, so as intestinal mucosa is injured, these brush water membrane enzymes lost their function, and thus disaccharide deficiency result. Congenital disaccharide deficiency is due to the variation in DNA sequence that control the gene for the particular disaccharide. So there is a defect in the DNA sequence on the chromosome that control the gene that form that particular disaccharide. What are the results of these disaccharide deficiency diseases? As the particular disaccharide is deficient, that disaccharide can't be converted into simpler carbohydrate or monosaccharide, and so that undigested carbohydrate enter large intestine. In large intestine, there are two effects. Firstly, these undigested carbohydrates are osmotically active, which means they draw water in. They cause influx of water, draw water in intestine, and cause diarrhea. Secondly, undigested carbohydrates are acted upon by bacteria, fermented by bacteria, and these bacteria convert them into lactic acid, acetic acid, and hydrogen, as a result of which person can experience abdominal cramps, flatulence, nausea, etc. And here this hydrogen is very important. It is measured in breath as the diagnosis for disaccharide deficiency. Now we take the example of lactose intolerance. Similarly, as disaccharide deficiency, lactose intolerance can be either congenital or acquired. Congenital lactose intolerance is due to defect in DNA sequence. Defect in DNA sequence on chromosome number 2. On chromosome number 2, there is a DNA sequence which controls the expression of the gene for enzyme lactase. As this particular DNA sequence which controls the expression of gene for enzyme lactase is defective, this gene becomes defective, and thus lactase enzyme can't be formed and lactose intolerance occur. Acquired lactose tolerance can be of two types: primary and secondary. Primary acquired lactose intolerance is decline in amount of enzyme with age, with advancing age. लैक्टेज की कंसनट्रेशन कम होती जाती है जैसे जैसे इंसान की एज ज़्यादा होती जाती है. एंड सेकेंडरी एक्वायर्ड लैक्टोज इंटॉलरेंस इज़ ड्यू टू सम GI infection, GIT tract infection, or some drug, etc. It means it is due during acute illness, and after the patients recover from the illness, lactase concentration can be recovered also.
Come to the treatment of lactose intolerance, which is saying no to milk, because milk contains lactose, but our body lacks enzyme lactase, which is needed to hydrolyze lactose. and this undigested lactose, this unhydrolyzed lactose enter large intestine and cause all this, and the person can be suffer from abdominal cramps, flatulence, nausea, etc. So the treatment include prevention of milk, but preventing milk can cause calcium insufficiency. तो कैल्शियम की कमी को पूरा करने के लिए काफ़ी सारी चीज़ें ली जा सकती हैं, और उनमें एक है डेयरी प्रोडक्ट्स। तो जहन में ये सवाल पैदा होता है कि डेयरी प्रोडक्ट्स में भी तो लैक्टोज होता है, और इसका जवाब ये है कि डेयरी प्रोडक्ट्स में लैक्टोज तो प्रेजेंट होता है, लेकिन इनको बैक्टीरिया फर्मेंट कर देते हैं, और फर्मेंटेशन का प्रोसेस और एजिंग जो है इनमें लैक्टोज के कंटेंट को काफ़ी सारा कम कर देते हैं, और ये उतने हार्मफुल नहीं रहते बॉडी के लिए जितना अगर हम मिल्क इनटेक करें तो वो हार्मफुल होगा।
Most accurately, we should take lactose treated product. We should take lactase pill before meal. उसके अलावा कैल्शियम की कमी को पूरा करने के लिए ग्रीन वेजिटेबल्स ली जा सकती हैं। ग्रीन वेजिटेबल्स लेनी चाहिए ताकि कैल्शियम की कमी ना हो। नेक्स्ट वी हैव Sucrase isomaltase deficiency. In this deficiency, patient is sucrose intolerant, and treatment include dietary restriction of sucrose.
This is all about disaccharidases deficiency diseases. If you have any question, you are free to ask. Thank you.